Hello everyone. Today, we are going to talk about one of the commonest mood disorders. That is bipolar disorder. Before we come to bipolar disorder, let's talk a bit about moods. Pause the video and think for a moment. What is a mood? A mood is a temporary state of the mind, or simply, a feeling. And also, throughout the day our mood keeps changing from one to another. It could be happy, fun, sad, gloomy, angry, irritated, sweet, romantic, and so on. So, now you know, there are a lot of types of moods. All those moods can be categorized into three main types of moods. They are elevated mood, low mood, and neutral mood. So, in elevated mood, we become cheerful, optimistic, which is that you will feel very positive of yourself and the surrounding, and feel very energetic, less sleepy, increased appetite. Conversely, in a low mood, we feel sad, pessimistic, low self-esteem, anxious, tired, frustrated, and low appetite. And also, we feel like we are useless. Now let's come to the mood disorders. Mood disorders are mental health problems that affect a person's emotional state. Depression, mania, and bipolar disorder are the commonest mood disorders that we see in the community. In this lesson, we are focusing on bipolar disorder. So, bipolar disorder is characterized by periods of low mood or depression, and periods of high moods or mania, throughout the lifetime. It is a commonly identified fact that bipolar disorder usually starts from a depressive episode. Community studies have found out that the mean onset of bipolar disorder is at 21 years, unlike in depression, which is usually triggered by stress which can occur at any time of life. A depressive episode lasts less compared to an episode in depression. An average length of a manic episode is about 6 months. However, these time durations can vary. In between the mood episodes the individual will have a normal mood. Over a 25-year follow-up study, they have found out that, on average, bipolar patients experience about 10 further episodes of major mood disturbances. The bipolar disorder could be familial or acquired. Recent studies have found out that there's a lifetime risk of 0.3 to 1.5% for a person to have bipolar disorder. And both males and females equally have a risk of getting bipolar disorder. Bipolar disorder shows strong associations with depression, anxiety disorders, substance misuse, and also with cardiovascular diseases. The causes of bipolar disorder may be due to genetic, environmental, and neurobiological factors. It is a common finding that there's a very high chance of getting bipolar disorder if the individual has bipolar disorder in the first family degree. It is also said to have a polygenic inheritance pattern. Polygenic inheritance means that the inheritance is due to a combined action of multiple genes. Environmental factors are also likely to be involved in the pathophysiology of bipolar disorder. Environmental factors such as life events, lack of sleep, lack of rest have a major impact on the disease. Also, recent studies have found out that mania is linked with increased dopamine activity. Now, let's go to the clinical features of bipolar disorder. They are mania, hypomania, and depression. In mania, the most characteristic findings are elevated mood, increased activity, and the individual will be having self-important ideas. On the other hand, hypomania is less severe compared to mania and the overall risk to the individual and the society is relatively less. There will be no psychotic symptoms in hypomania, whereas, they're present in mania. And also, hypomania might be difficult to identify in day-to-day life. In a depressive episode, the patient will be in a low mood and shows typical features of depression. Usually, in a depressive episode in bipolar disorder, the time duration is relatively less compared to a depressive episode in depression. Now, let's talk a bit more about mania. Following are the characteristic features that can be seen in mania. The individuals will be in an elevated mood and can be very cheerful with excessive optimism. But, at times, they can be irritable or angry due to excessive energy. Most of the time, they are overactive. And there will be increased appetite and reduced sleep. They will wake up early in the morning due to the reduced need for sleep. Also, there will be fast, pressured sleep and flight of ideas when speaking. Flight of ideas defined by rapid change of topics during speaking. At the same time, they will be extravagant. They can show psychotic symptoms like delusions and hallucinations. The main problem with individuals with mania is that they will engage in risky behaviors. Because of all these problems, there will be impaired insight which will be problematic when making decisions. To diagnose a manic episode, above-mentioned features should be present at least for a week and they should have affected the individual's lifestyle. To diagnose bipolar disorder, there should be at least 2 episodes of mood problems and, at least one of them needs to be a manic episode. The treatment of bipolar disorder can be divided into non-pharmacological and pharmacological methods. As for non-pharmacological methods, educating the patient and the family is very important. Appropriate support needs to be given to the patient and the family. Cognitive behavioral therapy is a type of psychotherapy, in which negative thoughts about the self and world are challenged to get good outcomes. Electroconvulsive therapy can also be used in severe cases of bipolar disorder. When it comes to pharmacological methods, mood stabilizers like lithium and sodium valproate, typical antipsychotics like haloperidol, and atypical antipsychotics like olanzapine and quetiapine. If the patient is anxious, short-term benzodiazepines like diazepam and clonazepam can be recommended. In the management of bipolar disorder, the prevention of future episodes is important. Therefore, continuing treatment, avoid breaking rest, recognize early warning signs, and seeking early treatment is very important.
Hope you enjoyed the video and don't forget to like, comment and subscribe.